No, it's a small hole, like the size of a dime. Right, Doc?
Mm-hmm.
You're going to speak with the neurosurgeon? This is crazy.
It's a
Stop
minor
it.
enough procedure that most patients go home the next day.
So she is talking about the whole size of a brain biopsy. That's not your place to say. That is crazy. Stop doing that. It should be the neurosurgeon discussing this. Even if this was a patient's best option, even an ER attending like myself, we're not going to have that conversation with the patient, let alone an ER resident doing that. She hasn't even discussed it with neurosurgery yet. None of the attendings I work with or any of the residents I work with are going to be having a discussion like that. It doesn't matter if it's internal medicine, family medicine, they're not going to be having the discussion she's having. Now, having said that, if you discuss this with the neurosurgeon, he told you his plan, what he planned to do, what he wanted to do, what the options were, but he was in the OR and couldn't make it down for a few hours. Sure, relay that information to the patient. I will then let that slide.
And then they'll know what it is and how to treat it. Isn't that right?
Yeah, exactly.
After I speak with neurosurgery.
I'm sorry that they called you. I never updated the form, I guess.
No, it's okay. They called and I was just kind of surprised.
Well, you didn't have to come.
But I did.
I heard you got married. Congratulations.
Thank you.
I hope he treats you well. And you deserve to be happy.
It's sad.
I'm really sorry you're going through this, Michael.
Yeah. Me too. But you know me. I'm a survivor.
I haven't seen him in like 4 years.
I can't imagine. That must have been
So crazy. Things were not good at the end. He was a really different person. Huge temper. Not like when we first got married.
I'm so sorry.
Could that mass have been there for a while and only recently got worse?
Yes.
Could it be responsible for how much he changed? His moods and tempers. He was getting into fights with strangers.
It's possible.
Based on the changes he had and now the location of his mass within that frontal lobe, it is possible that some of his changes are related to the location of that mass, given that location is associated with higher level cognitive function that we talked about earlier that's affected.